Imagine going to the doctor for a checkup and being told an AI has already predicted the month you'll die. Not based on a gut feeling, not based on symptoms, but from analyzing thousands of hidden patterns in your data and making a prediction no human could. This isn't the future. This is happening right now. Hospitals across the world are testing artificial intelligence models trained to predict your time of death, using nothing but your medical records and behavioral data. These AIs aren't just diagnosing disease. They're becoming digital fortune tellers for your health. But how accurate are they? And more importantly, should they even exist? Let's explore how AI is learning to predict your death, how it's already being used, and the massive ethical storm it's creating. It started with a problem. Doctors are human. That means they're limited by time, by data, by emotion, and by cognitive bias. Predicting life expectancy, especially for terminally ill patients, is incredibly difficult, even for experienced professionals. That's where machine learning comes in. By training deep neural networks on millions of anonymized patient records, researchers created AIs that can detect patterns most doctors would never notice. Heart rate variability, lab results, medication history, genetic markers, even small behavioral trends from fitness trackers or smartwatches. And once these models had enough training, the results were shocking. One study showed that an AI model predicted 12-month mortality risk more accurately than oncologists. Another trial at Stanford found an AI system correctly flagged high-risk patients weeks before human doctors did. Suddenly, hospitals had a new tool, one that could look at a patient and calculate their statistical likelihood of dying within a set time frame. Now let's be clear. This isn't some dystopian, you will die on June 12th at 4 p.m. level prediction. It's probability-based. The model might say, based on this data, there's an 87% chance this person will pass away in the next 6 months. But that's enough to dramatically change how hospitals treat patients. In emergency rooms, these AIs are being used to help triage care. Doctors can prioritize those who have the best shot at survival or start comfort care earlier for those nearing the end of life. In some cases, it's saving lives by triggering early interventions. In others, it's helping families and patients prepare emotionally, spiritually, and financially for what's coming. But here's where it gets complicated. Who owns this data? If an AI knows your death risk, do you have the right to that prediction? Should your doctor tell you what the model sees? Or should this prediction be hidden to avoid panic, trauma, or lawsuits? In one test, doctors refused to share the AI's prediction with patients, fearing it would affect their mental health. But patients disagreed. In surveys, more than 70% said they'd want to know if an AI thought their time was almost up. It's your life, your timeline. Shouldn't you have the right to know? Now enter the real danger zone, insurance companies. If AIs can predict your risk of death, what's stopping health or life insurers from using that to raise your premiums or deny you coverage altogether? In some countries, insurers are legally barred from using genetic data, but nothing stops them from using AI-based risk profiles. They don't need to know why the AI flagged you. They just need the score. And if you're high risk, you're expensive. The incentives to deny or limit care become very real. Let's talk about another risk, false predictions. A model might predict death based on data, but what if it's wrong? How do we verify the algorithm? Who audits the predictions? There's no such thing as a perfect model. Even 90% accuracy means 1 in 10 predictions are false. That's one person being told they'll die soon when they won't, or one person being overlooked and dying without necessary care. And because these models are often black boxes, meaning we don't know exactly how they reach their conclusions, there's no clear way to challenge or appeal them. Imagine a machine saying you have 6 months to live, but can't explain why. That's terrifying. So why is this being done? Because in some ways it works really well. Hospitals are overwhelmed, resources are limited, and these models are helping to allocate time, money, and attention more efficiently. They're giving doctors a second opinion, one that's based on cold, emotionless statistics. And sometimes that's exactly what you need. They've even been shown to improve the quality of end-of-life care, giving families more time to prepare, and patients a chance to spend their final days in peace rather than in aggressive treatments. So yes, there's good here, but it's walking a fine line. Now zoom out. Imagine a world where your smartwatch constantly reports your death risk to your healthcare provider. AI updates your life score every week based on diet, sleep, and stress. Banks consider your health risk when offering loans. Employers hesitate to promote someone flagged as high risk. Governments use aggregate death data to plan resource distribution or social policy. This is not paranoia. These conversations are happening in real-world policy meetings right now. And at the center of it all, a machine that tells you when you're likely to die. So now we ask the most important question. Would you want to know? If you could see your statistical expiration date, would it help you live with purpose or haunt every decision you make? Some say knowledge is power. Others say ignorance is bliss. But when machines know more about your fate than you do, it may no longer be your choice. Drop your thoughts in the comments. Would you want an AI to predict your death? Why or why not? We'll be reading every reply, because this is a conversation we all need to have.